kidding.
I'm in a yoga room. Oh.
That's right. All right, guys, welcome everybody to the Weiner Wellness Virtual Summit. My name is Tracey Stroup. I'm a naturopathic doctor and hosting this event along with Candace Corcoran from Nutritional Frontiers. And we are so happy to be doing this with our partners in nutrition, the Weiner Wellness Center. With me today is Dr. Honigman, who is from the Weiner Wellness Center, and of course, Jamie Dorley, CEO of Nutritional Frontiers. Guys, thanks for being here. This is going to be a good discussion because I think this is a touchy subject and something that people need to know, but they don't have a lot of information about. So just so everyone knows, we are going to be discussing medications that can impact the brain negatively and what alternatives we can use instead of those medications. And like Dr. Honigman, you said this morning, I watched you. It's not that we're against medications, but sometimes we can do better. And you said it is the abuse of those medications. So I'm going to let you start this off.
So first of all, it's great to be sharing this discussion with both you and Jamie. So thanks for having me.
Yeah.
And well, over the past few days, since first hearing about what our topic would be, I actually didn't know what I could contribute until yesterday. So it's true. I decided that I would like to share an event that got me thinking about the negative bias that many in the medical profession have towards supplements, and then turn around and pass it on to their patients and the general public. So as you said, first, I want to make it clear that I'm not against the use of all drugs. In fact, some can be life-saving and some can even improve the quality of your life, depending on your disease and condition. However, I am against their misuse and abuse, which can be substantial. And it irks me that when supplements are offered to improve one's quality of life, that the medical profession will vilify supplements as being dangerous. So, in fact,
he's starting off light. Tell us how you really feel. No, I'm just kidding. Yeah. This is good. Okay. We have a lot of people jumping on saying how excited they are to hear about this. So hot topic, apparently.
Great. So this happened fairly recently. I'm watching the news on a major TV network. A medical doctor comes on and starts talking about the safety associated with the use of supplements. So he very seriously and authoritatively looks into the camera so that, everybody's getting this, this view of him. And he states, there were 23,000 emergency room visits due to supplements in 1 year. Now, for those who are listening, right, this can sound very disturbing. But what he didn't say was what was truly disturbing to me. And that there are 2,287,273 emergency room visits involving adverse reactions to prescribed pharmaceuticals in 2009, according to the National Institute of Health.
Dr. Honigman, that's properly prescribed and taken medication.
Yes,
correct?
These are prescribed pharmaceuticals.
Wow.
So that comes out to, if you do the math, that comes out to 2,264,000 more visits due to prescribed pharmaceuticals compared to supplements. So
everybody run. It's right, vitamin D.
So another way of saying this, another way of explaining this is that there were 99 times more ER visits due to a prescribed drug than a supplements. Now, think about that. That's not 10 times more.
Wow.
That's not 50 times more. Can you imagine somebody said, wow, you're 50 times more. They're likely to find someone in an emergency room due to a prescribed supplement, to a prescribed pharmaceutical than a supplement. That would be like so much. But wow. The actual figure is that it's 99 times more likely that someone will wind up in the emergency room from a prescribed drug than a supplement. So, for example,
Unbelievable. Thanks, Dr. Honigman. I mean, my head is spinning, and those numbers are true. I've heard Dr. Weiner mention them many times. Over 2 million hospitalizations per year, and the cause of death of properly prescribed medications is in the top 5 of deaths in the country. I know you guys know, but I'm going to ask you anyway. What is the #1 cause of death in the U.S.?
Heart disease.
Cardiovascular disease, right?
Yes.
Mhm.
So when I think about this, okay, so cardiovascular disease is
Sorry,
on
I
the
thought it was a
rapid
Jeopardy
rise.
question. I was like hitting my buzzer, but you weren't calling on me, so I just jumped in there. I was like, cardiovascular for 10, Alex.
It's what is cardiovascular disease
Oh,
if we're playing Jeopardy. So you both are minus
darn it, it was
200.
disqualified.
All right, so cardiovascular disease, we all know people that have suffered and died of some type of heart issues, including our fearless leader, right? Good friends of mine, relatives, we've all experienced that, right? It's over 700,000 people per year. And we look at, okay, well, what are some of the medications that are prescribed for cardiovascular disease to help prevent heart attacks and strokes? So the #1 drug category would be statin medications, right? Over $20 billion classification of drugs. So folks, those are things like Lipitor, right? Crestor. One of the most famous ones from right down the road was Baycol. That was Bayer's statin medication. And do you guys know why it was pulled off the market?
Mm-mm.
Rapid cause of death, right? So too many people died. So that's a really bad side effect. I think we all agree that's the #1 side effect that you can experience from medication. I think a close #2 is if anything affecting the brain. So look at the classifications that are recommended for cardiovascular disease, statin, so Lipitor, those type of things, Zocor, Baycor, those types of medications people are on. So you wonder, well, is cholesterol really the enemy, right? Because that's the pitch they're giving us, right? Cholesterol is the enemy. If we lower cholesterol, we'll lower cardiovascular disease risk. Have we seen a decline in heart disease?
No,
No.
increase.
Yeah.
Mhm.
Actually an increase. And not only that, what is the side effect I'm most concerned with is the cause of damage to the brain. Well, how would a cardiovascular prescribed medication cause damage to the brain? So I was lucky enough to work under Dr. Weiner and Dr. Jeffrey Bland, and they taught me the biochemistry behind it. Well, think about how those medications work. If you want to slow down cholesterol production, it's produced in the liver. There's an enzyme actually called HMG-CoA reductase that produces cholesterol. HMG-CoA reductase. What else does it produce? CoQ10, which is a really important antioxidant. It's called ubiquinone or ubiquinol because it's ubiquitous to the body. We store it in muscle and all of our organs, especially the liver, the heart, and the brain. So we're taking these medications to lower our risk of cardiovascular disease, and that's not working. Now we are lowering our CoQ10 production. And what are some of the side effects? Dr. H, have you had anybody ever come in with muscle pain and fatigue?
Oh, it's very common.
Yeah.
You know,
And do you ever correlate it with the consumption of Lipitor or statin medications?
oh, absolutely. Mm-hmm.
Because it's stopping and slowing down. Lipitor, published studies show it actually reduces the production of CoQ10 by 40%. So if you shut the power to your house off by 40%, it's almost 50, half of the lights in your house wouldn't work. If you shut down half of your manufacturing cells in your body that produce energy, how are you going to feel? My dad went through this. He went to the doctor, said he was fatigued. They just put him on a cholesterol med. What the doctor say? Oh, you're just getting old. He says, I still kick butt. I'm still on my roof. I'm still taking care of 5 acres of property. I golf, I bowl. I'm not getting old in 3 months, but I feel pain in my legs. The other place it's depleting CoQ10 is in the brain. So have you guys seen in your practices and your experience an increase in brain issues such as mood disorders, depression, anxiety? What about long-term ramifications of low CoQ10 in the brain, such as dementia, Alzheimer's, and Parkinson's? Have you seen an increase of those?
Yeah. Mhm.
So when we look at what type of medications are correlated with brain dysfunction, the biggest one on my list, the number one on my list, and my biggest concern is the huge consumption of these statin medications
Mhm.
and short-term effect on muscle function, energy, and the heart's a muscle, folks. Don't forget that, right? And then we're lowering CoQ10 by 50%.
Mhm.
And now we're seeing the increase of statin consumption. And it's almost the same pattern you see with the increase in Alzheimer's and Parkinson's.
Yeah.
So this is a huge concern of mine.
Well, another thing that I wanted to share was with Dr. Len Bransowitz, who is a pharmacist, licensed pharmacist. He's also an ND-MD. So he went back to school after he had his medical degree and became a naturopathic doctor, functional medicine, and still practices today, has been in practice for over 40 years. And he wrote a lot of these sections on medication because he understands medications. That's what he does. He's pharmaceuticals. But he also realizes that the impact, the long-term effects and toxicity of even some medications and short-term effects and what they're doing. And here's what he said about statins. He said, we need at least levels of 160 of cholesterol to regenerate the brain. Cholesterol is a building block of all cells of the brain. And when we lower levels of cholesterol below 160, the brain literally becomes dry, and for use over 2 years, it causes permanent brain damage in the person that's using it. So I thought that was a really hard point to like accept, because I know family members of mine are on statins. So Jamie, this can seem really scary for people that are on cholesterol medicine now. So I want to come out and say, we are not recommending that you stop any medication that is properly prescribed by your physician. This is a conversation with them that you will have become aware of information and you have questions. You can go research all of this information on PubMed or other resources that are out there. You can read the insert to your medication, which is legally yours if you ask your pharmacist. But here's one thing that we do recommend, that if you are choosing to take these medications for whatever reason, that you properly nourish your body to offset the damage that they can create. And one of the things that Dr. Len Bransowitz said, that in 2009, the Iowa State University study determined that the continual use of statins started at an earlier age, which we're seeing in the 20s and 30s, to reduce cholesterol below 160 will affect the brain functionality. You'll see earlier onset Alzheimer's, dementia, lack of focus, depression, all of these other things. So he recommended that we nourish the brain with 3 things: CoQ10, omegas, and vitamin B to keep the neurotransmitter production optimal. So what say you guys?
Oh. Tracy?
Mm-hmm.
Okay, so first of all, most of the studies that were done on statins that were done before 2005 were all done by statin-producing companies. A lot of that data is all biased. So you can only look at the data from, say, like 2005 on. And there is a massive amount of data, from before 2005 telling you that the statins will cure everything that has to do with your heart. That's number one. Number two, when you get a conventional lab test, they are measuring the volume of cholesterol. They're not measuring the particle size. They're also not telling you whether or not they are oxidized or not. So first of all, I don't know if you can see this, but this is a trash can. Now, you can fill this trash can with rocks, or you can fill it with pebbles. You can fill a lot more pebbles in this trash can than you can rocks. When you get a conventional lab test back and it gives you the cholesterol number, it's just telling you that you've got a trash can. It's not telling you the amount that's within it. And the 2 most important things with cholesterol are the particle size and whether or not they're oxidized, neither of which you are getting in a conventional lab test. So oftentimes the medication is being prescribed and people may not even have a problem because they can have large particle sizes. The cholesterol itself might not be oxidized, and we know how important cholesterol can be. as long as it's not through the roof, right? It's the precursor to all of the steroid hormones, including estrogen and progesterone. It's important for biosynthesis. So, and it's important, of course, for the cell membrane itself. So these are more reasons why the cholesterol medication is being, statins particularly, are being abused. I also want to point out one more thing about that. There is absolutely no data that giving statins to people who do not have existing heart disease do any good whatsoever.
Right.
So you're not getting any benefit. All you're getting is the risk of the side effects.
Mm-hmm.
Yeah, I think a key part of this whole big picture with cardiovascular disease, statin medication, is lifestyle therapies.
Mm-hmm.
You know, I was doing a presentation for Jacksonville Shands Memorial Hospital. It's a chain of a dozen hospitals in Florida years ago, and I had about 25 doctors in there. And when I presented the NIH's ATP, Adult Treatment Panel Guidelines for Lipid Management, the one doctor that was on the side of the room that didn't like me, he raised his hand. He says, "What are you doing? Just making these numbers up?" I was like, "No, doc." I says, "They come from the NIH." He said, "Well, they must be brand new then." I says, "Actually, they're 2 years old." He got really upset because the NIH recommends for 3 months, if you have elevated cholesterol, lifestyle therapies and plant sterols, which are in our cholesterol red.
Mm-hmm.
It doesn't say bring in a medication until after they met with the nutritionist. So even the NIH is telling the doctors, hey, they got to address the lifestyle, because we never look at what's the cure, what's causing this cholesterol increase, right? And we know it's a lot of processed food. It's a lot of what I consider bad fats and sugar. So that's the cause of it. You're not going to out-medicate a bad diet and lifestyle. And that's why at the Wine and Wellness Center and Dr. Tracey and our team of Nutritional Frontiers, we promote the NF for Life program. We have all the books, all the literature, all the education, because you got to figure out what's causing it. Very rarely does someone have elevated cholesterol just due to genetics. I would say 95% of people it's because of their lifestyle. And it's not just cholesterol. You had pointed out particle size, so lipo-A and lipo-B, lipid protein. And then you look at triglycerides, right? That's probably a better sign of what's going on, because that's where the fat and the sugar in the diet's meeting. So I love the fact that you guys are really presenting a lot of good research today. And I like to keep things really simple. If you're already on a medication, you got to take CoQ10 and B vitamins at a minimum. I don't care. So we always focus on our program. The first thing we do is help replace the nutrients you're depleting from your medications. And there's big four. There's vitamins, minerals, probiotic, and CoQ10. If you're on any cardiovascular medication, diabetic medication, or antidepressant, you need to take CoQ10, folks. In fact, you can pretty much say anyone needs to take CoQ10 after the age of 40. It's one of our key nutrients. But the other thing I like, of course, is the fish oil. How do we know fish oil is so good? It's even a prescription version, right? Lavazza. And we work with Dr. Jorn Dyerberg. He is a known cardiologist. He's got a couple of studies, Dr. H. He's got 450 published studies. Would you say that's a good amount?
I'd say he's doing pretty good.
Yeah. He brought out fish oil in 1971. Tracey wasn't even born yet. Me and you were toddlers back then. And he brought out fish oil for triglycerides in 1971. And that's the guy on our team at Nutritional Frontiers and Wine and Wellness Center. So we utilize his purified fish oil. It goes through all the testing you need. It has the high levels of EPA and DHA, and it gets all third-party analysis, so there's no heavy metals or contaminants in it. So I love it, Tracey. Fish oil, omega-3 by Nutritional Frontiers, liquid or soft gel, Super B Complete, and Power Q. I like the Power Q 600 because you get the DMG and the CoQ10, and those are all available at your wellness center, Doc.
Yeah, and it's just important to fill those gaps now, and then have the conversation with your physician about lifestyle changes and things that you can do for 3 months. And then, have that discussion again about lowering or coming off those with the prescribing physician. So, I mean, we could go on forever and ever, but I'll say this one last line that Dr. Lenz said. He said, too much cholesterol, we understand the problem. He said, too little cholesterol, we completely ignore the problem and disease that it's creating. So I thought that was kind of like a, wow, that was a great wrap up. Just so many things with cholesterol, so many people on them. So lots of different names for cholesterol lowering meds, Lipitor, Crestor. You need to, check with your pharmacist about your dosage and levels, and of course your physician for any conversations or having those prescriptions changed. So, Dr. Honigman, I don't know how many kids you see in your practice. I know you've been in practice for a long, long time. I see a lot of kids. And mostly because I have kids, I know moms with kids. So I'm kind of like, oh, Tracey has kids and we know her, let's ask her. So one of the biggest things that I'm seeing now are kids, and especially now, on ADD and ADHD medications, especially the amphetamine-based medications, one in particular called Concerta. And this seems to be the go-to for doctors today with kids with ADD or ADHD. And it's the #1 prescribed medication for these two particular issues. It works on the GABA receptors of the brain to enhance function of senses. However, what happens over time is the dopamine receptors. So those GABA receptors, right? They're the things that make you like enjoy things in your life, right? Senses, what you see, what you hear, smell, taste, touch. And so kids that have ADD or ADHD, they can't focus. So all those senses get discombobulated, or ones are more heightened than the other. And so they give this drug that actually helps with, the GABA receptors. But what happens is it starts to dull down the dopamine receptors and they become compromised. And while it balances the senses, what you lose in the long run is the pleasure of those senses. So it's kind of a catch-22. Like for a while, the kid calms down, but then all of a sudden, 2 or 3 years in, you start to see depression, fatigue. They start to seek out other stimulants, caffeine, tobacco. Now it's vaping, soon drugs. They can have other addictions such as, OCD tendencies. These are the secondary issues that happen with the medications. And this process actually causes irreversible damage to the brain and permanent reduction of brain function. These children continue to require more and more of the prescription or other types of antidepressants. So they start to layer on medications and begin seeking other stimulants to feel happier. They start to seek things like sugar, tobacco, caffeine, any type that will stimulate that part of the brain. And as practitioners and parents, we must remember to educate and inform masses of the damage, which I think they don't come out and say, hey, we're going to put your kid on Concerta and while it will help him for a couple of years, this is going to cause irreversible damage to the dopamine receptors, and his pleasure sensors are going to decrease. Now, these are all studies. This is not opinion. This is what they've found with long-term use. And the younger they start, the harder it is to bring them back. So, it's kind of disheartening, when someone comes into my practice and I see that they're on here. So I have to do the same thing, right? The very first place I start with these kids is diet and gut. And I know that you're big on digestion, Dr. Honigman and Jamie, I know. But I know why I start them there. But if you want to chime in before, I don't want to take up at all. So go ahead. But this is one true to my heart.
Well, of course, diet and lifestyle are always the foundation of everything. And for the gut, we know that there is a gut-brain connection with the vast majority of serotonin. I believe it's up to 90% of the serotonin is actually produced in the gut. And we need healthy bacteria to make that happen. So we need a very functional, not dysfunctional, small intestine, gut. In addition, I just want to mention a little bit about GABA, go back to that, because GABA is like my favorite brain chemical. Because what it does, it acts like a brake on things that are overactive in the brain. And Lord knows that my brain can get overactive at times. So I'm always looking for natural means to increase GABA. And there are food methods, things like fermented foods like kefir and yogurt and tempeh could actually increase GABA, gamma aminobutyric acid. So this is without messing with the dopamine. These are ways to improve our gamma aminobutyric acid levels for the good, so that we can go through the day. And this goes back to what this is all about, to go about the day in a relaxed, focused, and peaceful state of mind, because the GABA quiets what I call the noise, all that overactivity that is happening, that we take these drugs, which have these dangerous side effects, to reach that level. So of course the gut is also responsible for a lot of dopamine production as well, not just serotonin. So yes, Tracey, the gut is very, very, very important. Look, the gut is, if nothing else, it's where our food gets absorbed.
Right.
So
Yeah, and the newer research, you're right, is showing that 50% of dopamine is in the intestinal tract, right? They call it the second brain. You mentioned the gut-brain connection. 95% is serotonin. So some of the newer journals, it takes years for the science to become practical, but some of the newer journals we looked at, psychology and psychiatry, those type of magazines, the journals are saying, hey, do we need to look at psychiatric treatment differently, right? Do we need to look at the connection with the gut? Now, functional medicine, we've been saying this a long time, right? Dr. Bland and Dr. Weiner talked about this 10 years ago, but it's just starting to get some momentum out there. So people are going to hear more and more about this, but absolutely. And then the other thing is, I think it's the overstimulation, right? That we've almost become desensitized to it. So that we need more and more and more to get the same feeling. So I think the best approach is take a step back and realize, first of all, the human brain burns, it's only about 2% of our weight. I mean, mine might be a little heavier because I got a big head, but big head, big brain, right? So it's about 3% of my weight, but it burns about 30% of your energy every day. So if you're not giving the body the energy it needs, well, no wonder you're depressed, and no wonder you're anxious, and no wonder you can't pump the brakes on your own. No wonder you can't focus, right? You can't complete tasks, you're overstressed. And I think, we got to really go back to the foundations, right? If people are overstimulating their body, they're not giving the nutrients it needs. I mean, it's like trying to run your car without having the right fuel in it. It's not going to run well. If you went to the mechanic and said, hey, my car's not running well, what'd you put in the tank? Coca-Cola, he would say, well, you're crazy, right? But people live on this, especially the kids. So that's a big concern of mine, because that's our future of our country. And the kids now, the teenagers and 20-somethings, is the first generation that has a shorter life expectancy than their parents. First time in history. Yeah. And it's not only the life expectancy, but more the functionality. I'm working with some really progressive, innovative nutritionists up here in Michigan this week, and they're just sharing with me some stories of some of their patients. It's because we were talking about stress and hormones today and brain function. It's unbelievable that what you're saying, the GABA alone, just to kind of pump the brakes, people are so wired, they can't even get to calm down. So these dopamine inhibiting medications, these are scary. Because I think again, we want to try and fix people so quick. We're not looking at what's causing the problem. So B vitamins, I mean, I mentioned Super B Complete 20 times in the last 2 days training, right? I mentioned fish oil many, many times. Talked about balancing blood sugar all these times, getting off energy drinks, all these different things that if you do that, maybe you don't need, Tracey, to go get those medications, right? And if you are on medications, you can take B vitamins. They are the building block of all the neurotransmitters in the brain, dopamine, serotonin, GABA. epinephrine, norepinephrine. If you wanted to make those in your brain, which you should want to make those every day, you got to take B vitamins.
The
So
other thing about these kids in particular, Jamie, was that their exit strategy of their body seems to be narrowed. They don't detoxify. Kids that have these particular issues and are on this particular medication. So the B vitamins come in and they do a great thing, but they have to have an end game as well. They have to be able to detoxify their body. And most of these kids, you know, that have these type of issues, they're just overloaded with toxins. So it causes this excitatory effect in their body. They're in this chronic cytokine storm from chronic inflammation. So they get sick from everything. So, you know, utilizing something like GI Complete is one of my first go-tos, because not only does it enhance digestive function, it also cleans out the digestive tract with many things that are in there, gets them going to the bathroom regularly. I love the lymphatic tincture for these kids. I love the liver gallbladder tincture for these kids. And I like liquids or chewables for kids just because they're easier to administer. And then I love DMG just for the cognitive function and just helping them, along with some other things that I might recommend, like frankincense and essential oils, just to like help the brain neurology just calm down a little bit. But it's sad because they go from excited about everything and overabundance, right? And the GABAs can't go, whoa, to let's just crush the dopamine receptors so that they don't really feel anything. So it's like we've created these zombie children, right? Yeah, they're calmed down and they fit into society nice, but our suicide rates are skyrocketing in children. You know, our depression rates are skyrocketing in children. And for parents, they don't know what to do. And it's heartbreaking for a mom to come into my office and say, this was our last hope for our son. Like it was, we couldn't keep him in schools. He got kicked out of every place. He was getting into drugs. He was doing that. He's like, but when we did this drug, it helped. But now it's not working. And he's at the max level and they want to stack on 2 antidepressants. I mean, where's this kid going to go in life? You know, we can't just continue this model of like suppression and pill for an ill. We have to do better as healthcare professionals and not be afraid to speak out and tell these parents the truth about, listen, go read your insert, right? It's right there. If I know this, you can know this. Find out before, you know, educate before you medicate. That's like the biggest thing that we should be telling people. You need to educate before you medicate. Educate on lifestyle changes and the impact on those issues. Educate on pharmacology and the impact on those issues, the toxicity. Educate on nutraceuticals and the impact. Like, you need to educate before you medicate today, because the medications are getting bigger and badder and quicker. And when you have something that works that fast in the body and will force your body to do something so quickly, there's always an effect. There's always a cause, you know, an effect to whatever this push is. So, you know, that's the whole conservation of energy, right? It's never created nor destroyed. It just changes.
So first of all, like, I think everybody should have one of these anyway. Okay. This is the drug handbook, Nursing You 2020. And all you have to do is
you show it from the side so we can see how thick that thing is. Wow, it's big.
Yeah, it covers a lot of drugs.
Holy man.
But it'll also go over all of the different problems that potentially are associated with them, all of the side effects. And there are a lot, and they only include the ones that are 1% or more. So that's interesting.
Oh my gosh.
Now, I also want to briefly mention something called L-theanine. Now, everything that Jamie, everything that you've said, and of course, everything that you've said, Tracey, is absolutely, that's just wonderful information and so important for mothers to know. But there was actually a recent article in a journal talking about the use of L-theanine to help people with ADD to sleep. And in a double-blind study, it was shown to be an effective alternative. And again, the L-theanine, it stimulates activity in the brain known as alpha waves. And that's associated with that relaxed and alert, focused state of mind. And I think we can all agree that's what we're trying to get, that relaxed, focused, peaceful state of mind, no matter what age we are. So think about L-theanine, and you guys have a very nice L-theanine product that has that patented suntheanine in it.
Calm
So
day and sleep
I
time.
also recommend that to both to kids and especially adults and to myself.
So this particular client, not mentioning any names, but their child was on the highest dose, legally allowed prescribed for children of Concerta. And I texted Dr. Len because I wanted to have his opinion because he's a pharmacist and an NDMD. And I said, what do I do? And he said, therapeutic levels of L-theanine. And he also said, good luck. So I was like, well, I have amazing belief in the body's ability to recover. And, these parents and this child are ready, willing, and able, and are doing all the right things, have seen improvement. And, I think that while studies may show that there's irreversible damage, they probably didn't take a pathway of rebuilding the brain after use of this drug. So they probably have no research on, hey, what if we got these kids off this drug and did L-theanine and omegas and B vitamins and rebuilt the brain? And then let's do a research on the definitive of that. There's no coming back from it. See, I don't believe those ends of the research because I know they're not out there researching how to recover the brain.
Yeah, Dr. H, you had mentioned a few nutrients. I just wanted to reinforce for people that GABA and also the suntheanine, which is a trademark patented research ingredient that we use at Nutritional Frontiers and available at the Wine and Wellness Center. They are both in the calm day and the sleep time. Look at him, Tracy. He's got them all.
Here it is. Calm day. You can actually get one of these by calling our office.
He's doing the QVC commercial I was doing the other day. I have the bottles. They sit right here because, during the day, I'm like, I might need a little break. So.
Bottle and the information, all available.
That's right. Well, it's important.
Yeah, and that's
people are asking right now, how do you pick a good quality supplement? How do you know? And that's important because you're trying to help your child, So Jamie, talk about that suntheanine, why it's so awesome.
Yeah, so Nutritional Frontiers was founded by Dr. Weiner and myself. And the whole goal was that we would create more comprehensive formulations so that you wouldn't have to take 6, 7, 8, 9, 10 different things. So that was one thing. The other thing was we wanted multiple delivery system options for you. And then we wanted to use the right ingredients in the right amounts in the right forms. So we use over 50 patented, research, trademarked ingredients, just like you'd buy a brand of anything else, shoes or car or anything. When you buy a certain brand, it comes with quality and expectations. So for the theanine, there's a lot of generic theanines available on the market. The number one theanine is called suntheanine that we actually utilize by itself as a standalone. We actually have it in calm day and sleep time. So we use a lot of trademarked ingredients so that that ingredient, like you mentioned, Dr. H, has all the research behind it. And that's why we utilize it, especially in situations like this where it's imperative that we're able to, as you would say, pump the brakes, right, with GABA, and also get the focus and take the edge off with theanine. So we utilize it in those two formulas. It's also in a formula called Control that I was actually doing some training on yesterday. That's great for controlling cravings, and that could be for sugar, alcohol, drugs, whatever it may be, caffeine, nicotine. So that's called Control, and that has theanine in it also.
So for those just dropping in or just tuning in right now, we're talking about medications and the impact that they may have on the brain. So far, we have covered amphetamines or things that are prescribed for ADHD or ADD. We have covered cardiovascular and statin lowering drugs. In the time that we have, there's two left that I was thinking are probably the highest prescribed and cause a lot of damage. One is antihistamines, whether it's over the counter and self-prescribed or by a doctor. And the next one is acid blockers, proton pump inhibitors. Let's start with the acid blockers or the proton pump inhibitors. The top 4 medications in the country are for digestive issues. So, and PPIs, under investigation, right? You take these particular ones and they have impact on the brain. So what do you guys want to say? I mean, I know Dr. Len's biggest thing with these two is that they drastically decrease your ability to absorb B12.
Yeah, I was just gonna say that. I'll be real quick because I know Dr. H has a lot more details. But Dr. Weiner always said that if you're inhibiting your acid production, and it's usually not too much acid, it's in the wrong place. You either have putrefied foods in your gut that's creating bacteria that spins off acid, or the other thing is you may have a hiatal hernia. So Dr. Honigman actually performs a physical maneuver in his office to fix the sphincter right here, the diaphragm. You can push that down so he can fix your acid reflux and recommend some nutrients. But of course, you got to change the diet, because if you are on acid blockers, you're not absorbing B12. And we mentioned how many times today, but the importance of B12 for brain, but you're not absorbing a lot of your nutrients. And what we just talked about, 30% of your energy is burned by the brain. So that's where I go right away, is we're not getting the energy, the vitamins, the minerals we need for brain function.
So here was a quote, Dr. H, from Len. And you can find all of this stuff that Dr. Len wrote. Again, pharmacist, NDMD, right? And Dr. Honigman, I'm sure you're going to come in on this as well. But this is in our Holistic Truth that's put out by Nutritional Frontiers, and you can find that on our website and copies at the Weiner Wellness Center. Please go pick one up. In time, the gut-brain relationship is compromised. Lower levels of serotonin are produced. The spiral of health begins to happen as low levels of serotonin lead to anxiety and depression. For relief of these symptoms, many seek the help of a medical physician and are prescribed a select serotonin uptake inhibitor, which is an SSRI. These medications control the uptake of serotonin. However, due to the B vitamin depletion, serotonin levels continue to fall, and the result is either stronger medications for depression, or increasing your levels. So you're chasing symptoms. So basically what he was saying is these PPIs actually have the digestive system create lower levels of serotonin overall. So even if you're taking an SSRI to kind of uptake that, there's just not enough. And so it just doesn't work. So the end result of long-term use of these acid reducers or PPIs, proton pump inhibitors, he's like, it's directly going to affect your brain, your neurology, your serotonin, your dopamine. He's like, it's going to cause this secondary issue.
Yes.
Absolutely.
They affect so much in your body, and they can do so much damage. Well, first of all, PPIs were originally designed to only be used for a very short period of time. I mean, look, what is the cause of acid reflux? Is it because you have too much acid? No, right? The cause of acid reflux really comes down to two things. Either you don't have the gut motility that's pushing the nutrients through your body, and they're sitting in your stomach, which allows more time for it to reflux. But more importantly, it has something to do with the lower esophageal sphincter. That's that little flap that allows the acid to go back up. Normally that shuts. So if it doesn't shut properly, that's what we have to be looking at first of all. And there are many different reasons why that can be happening. And one of them that it isn't because you're not taking enough proton pump inhibitors. That's one thing for sure, right?
They don't have a deficiency in PPIs.
It could be due to gut dysbiosis. It could be due to an imbalance in your gut bacteria versus the bad things that are causing inflammation that are then affecting the lower esophageal sphincter. And then as a result, you take these proton pump inhibitors, which, as you say, is going to affect the absorption of B12. And then that winds up affecting your brain. And there's so many other bad things that proton pump inhibitors do. I mean, just look them up in the nurse's manual and you'll get a gigantic list.
And B12 is really important for the myelin sheath. Is that correct, Jamie? Right. And for that, and people don't understand that can lead to tremors and other issues that deal with myelin sheath.
Yeah, your entire nervous system, right? So from the brains down to your fingertips, right? So if you have numbness, think about a diabetic, right? Someone who has neuropathies, it could be diabetes or something else, right? Energy overall, right? That's why people get a B12 shot. But there's so many reasons for it. I think people are somewhat, if they haven't been exposed to functional medicine or wellness, I think sometimes they're just completely baffled, right? It's like, well, what do you mean? I have too much acid, it's coming up. Well, let's think about what may be causing it. Maybe you're overeating too much, right? Just the volume of food in the stomach can push up on this diaphragm. Maybe you are eating foods or what we call junk that's not breaking down in the intestinal tract.
Mm-hmm.
If you eat all this, I mean, there's been many examples of our doctors that will buy a Big Mac, they'll put it in a case in their office, and they'll have a date on it. It doesn't break down. The bun doesn't even break down. So if you're eating junk and it's just sitting in there, if it's not going to break down at room temperature, it's not going to break down in the body, right?
Yeah.
And Doc used to talk about all that heat that's in there, the putrefaction of the food, creating bacteria, that's spitting off extra acid, and then lo and behold, you know, you're overweight, you have all this pressure coming, and then, oh, I got acid reflux. But I want to make one more point before I jump off. Dr. H, you had mentioned omeprazole, which is used to be prescription, is now over the counter antacid, right? It says right on the box, I read it. Do not take for more than 14 days. The average
Nobody
person
reads the box.
takes that for years.
Right.
And it used to be prescription. Now you can just go in and buy it over the counter.
And that was what Dr. Lenz said last. He said over the counter is even worse because people self-prescribe, self-medicate, and they create a worsening of the B vitamin deficiency and the overall depletion of serotonin in the digestive system. He said eventually these people will create brain dysfunction, and he's like, in less than 5 years. So amazing that we can just do that, you know. So it's really important, again, to educate before you medicate on all realms. And we love Probezyme. Wait, I got the QVC coming at you. We love
Great
Probezyme.
minds think alike.
That's right, because these are chewable. So for people that like to pop the Tums, but they're also an enzyme probiotic combination. So Dr. Honigman, you were saying about the value of probiotics and dysbiosis, also enzymatic action for assimilation. And also if you do eat too much, these guys go to work. They start pre-digesting that food for you and munching it down. So if you're on a PPI over the counter or you're on an acid reducer, talk to your doctor about lifestyle changes that you want to make. Get on some good probiotics and enzymes. Start taking some extra B12. We have a great methyl B12 folate that you can chew because you are deficient, period. That's what most of the studies are saying, is that you're B12 deficient. That's going to affect all of your neurology, from, like you said, tingling fingertips to the fact that you can't remember anything. So, and then later, if you let that go and prolong, you're going to have issues with dementia and Alzheimer's and depression, and it can just lead down the pipeline. So a place and a space for everything, right? I know that there are some medications that people cannot live without. And, you know, I'm really thankful that we have developed those things. But it's like you said in the beginning, Dr. Honigman, it's the abuse and overprescription and the absolute, you know, talk to the hand. I'm not discussing vitamins and nutrients in my office that we see from some of the medical professionals out there. Not all, but some. I mean, you are a, you know, a licensed chiropractor, so you are considered in the medical field, and that's how you start, with functional medicine and lifestyle. And, you know, so there are great practitioners out there that are available to people watching today. So many that you can go see, so many great products that can help you fill gaps. Please be open-minded about it. Please do your research and your homework and keep educating. It's really important.
Yeah, and Dr. Honigman is a humble guy, so I'll brag for him. This guy has a bachelor's in science, doctor of chiropractic, master's in public health, has been teaching functional medicine for decades. And look at the guy, he practices what he preaches. He looks great and high energy, and always exciting to learn from him. So I am honored to be on here with you guys. Thanks so much for helping me today to learn more about this. I really appreciate it. And it was great to be part of this. Thank you.
Thank you, Jamie. So Dr. Honigman, I'm going to let you end this for us with anything you want to impart on words of wisdom.
Well, first of all, thank you for having me on this discussion. And it is my honor as well, because both of you are very modest. I know. Sometimes Jamie says, well, you should see all of the letters at the end of Dr. Honigman's name.
There's
but
a lot.
The truth is that both you and Jamie probably have more letters than I do.
Untrue.
Is your expertise that you're willing to share so graciously with the general public and other health professionals as well. I guess the only thing that I want to say is that for all of us, I'm going to go out on a limb and say that, our focus is always on the optimal restoration and health of the mind, body, and soul. That's our goal. And we take a very holistic and functional wellness approach, all of us do, to achieving that. So
great practitioners. So Dr. Honigman, just leave, how they can contact you, because I know you can do phone consults and lots of things. So how do they reach out to you and make an appointment if they want to discuss some of these things?
412-922-9355. That's the Weiner Wellness Center, and I work here. So 412-922-9355. And I also want to mention that, all of the supplements that we talked about today are 30% off right now. That's a great deal.
Right? And you'll ship.
What's more, I'm on the.
He's on the QVC trail.
So.
We're really good. We should be telemarketers. So thanks everybody for joining us. I hope this lecture blessed you. I know that I learned a lot, and I hope you share it with people that you love that may need some gaps filled, that are on medications. Again, we're not recommending you stop any medications prescribed by your doctor, but to have the open conversations and the open mind to continue to learn and really be an advocate for your own health. If you want to talk to a professional, a healthcare professional, about some alternatives or some gap fills that we can do for you, please reach out to the practitioners at the Weiner Wellness Center. I am always here to answer your questions as well. But Dr. Honigman, you're always wonderful. Thank you so much. And guys, thanks for joining us. Stay tuned for Mikey Gallagher. He's coming up next. He's going to be talking to us about inflammation. All right. See ya.